Welcome to our presentation of the implementation failure of Healthcare.gov, brought to you by Comfort Babatola, Cindy Courson, Kirsten Joyner, Eboni Murry, and Lee Walls. Information systems projects, large or small, are not simple to manage. Logistics become increasingly more complex in relation to the size of the project and naturally more difficult to manage according to the size of the endeavor. From this perspective, there are those who might argue that it should have been expected that the healthcare reform project would encounter significant setbacks in initial implementation efforts. For every project, especially a large project like the healthcare reform endeavor, a statement of scope would have preceded the initial commencement of the project. The initial scope document should have established clear chains of responsibility and communication means. There should have been a system of honest reporting of problems and necessary steps to take when there is a need to choose cutting or delaying certain project features. While the initial scope document may have been in existence for this project, it is obvious that it was never followed. One reason may be the fact that with most government agencies, good management of projects does not seem to be part of their standard operating procedures, thus the failure of the initial launch of the HCR project. Such failure could have resulted from one or more of the following issues. The healthcare reform project, in retrospect, exhibited several key management issues which contributed to the problems involved in this initial launch. First, there was a poorly designed initial master schedule which lacked sufficient time allowances for design and other development activities such as quality testing of the deliverable product. Further, project milestones were incompletely identified, which impeded the progression and tracking of project milestones. Also, the Health and Human Services CIO's oversight responsibilities of the Healthcare.gov website was impeded by the lack of honest communication from divisions such as the Centers for Medicare and Medicaid Services, whose leadership later voiced that they had deep concerns about the project early on. Another division, OMB, simply was not included on the CIO's radar as they should have been. OMB was the area responsible for overseeing the risk associated with major capital investments such as the healthcare reform project, and they exhibited no management role at all in the development of the Healthcare.gov site. There is suggestion also that a poorly communicated project scope document contributed to the overall management breakdown and flawed execution of the HCR project. And last, but certainly not least, there appears to have been little coordination and very poor communication efforts between the governmental project team and the software contractors responsible for the final product. Human factors in information system projects involve the need to coordinate the efforts of a diverse group of people. The diversity involved in the healthcare reform project included people at many different levels, including government employees and agencies, software developers, and newly established insurance delivery systems. It is an understatement to say that the coordination of the healthcare reform project was a mammoth venture in and of itself. Project control and communication between the elements of this massive project definitely suffered due to both its size and ambitious implementation goals. These foundational issues were the unforeseen factors when, following the launch of the HCR project, it quickly became clear that the Healthcare.gov website was inoperable. As a consequence of little coordination and communication amongst the contractors and project teams, the deployment failed miserably.
In addition to the management and communication issues of the Healthcare.gov, there were also design issues and technical issues. After the rollout date of the project, a series of poor quality codes were found in the system. Customers were unable to register, and there were reports of dead links within the site. These design issues were definitely the result of poor coordination among the developers. There was a severe lack of technical ownership, which led to improper system integration and data migration of the system they worked so hard to develop. The Healthcare.gov project also had some technical issues. First, we know there were inadequate testing and testing tools, and this was due to the time constraint and last-minute changes that were made to project plan. It appears that the only real test of the system was made on the 1st of October 2013, when that system was rolled out to the public. There was poor technical judgment on the part of the project managers who lacked the technical expertise needed to manage the project. There was inept technical methodologies, meaning that some of the codes were commented out, creating a loop or stall in the system.
Healthcare.gov was a project management failure that left a lot of its stakeholders wondering how the implementation was going to affect them. After doing research, most stakeholders agreed there needed to be a change, but was not convinced that Obamacare was the fail-proof change they were hoping for. On October the 1st, 2013, the American healthcare system and stakeholders' perspectives would forever be changed by the implementation of the Patient Protection and Affordable Care Act, often shortened to the Affordable Care Act, which is nicknamed Obamacare. Obamacare consisted of 92 different provisions to be phased in during its first 7 years of existence. Although there were numerous reasons why healthcare reform was critically needed in the United States, which include high health insurance rates and lack of coverage by many, unsustainable healthcare spending, lack of emphasis on prevention, and healthcare disparities. The stakeholders of Obamacare we're going to discuss are the patients, physicians, employers, insurance companies, and hospitals. The first stakeholder we're going to discuss are the patients and how they were affected by Obamacare. After doing a lot of research, I found that not all the changes Obamacare was implementing or trying to implement were negative to the patient, and some were actually very beneficial. For example, one such change eliminated insurance restrictions on individuals with pre-existing conditions, and also it allowed children to be covered under their parents' plan until they turned 26 years of age. However, there were also some potentially negative features patients will experience, such as possibly having to switch doctors due to the doctor not accepting Obamacare, switching doctors, and the possibility of receiving lesser skilled doctors due to them being cheaper, the potential for lesser quality of treatment performed due to the increased amount of patients doctors are trying to see each day to keep their revenue levels as high as possible, and the risk of higher premiums enforced by the patient's company, forcing the patient to bring home less money for the same coverage. When researching the physician's perspective on Obamacare, I found they were not as fortunate as the patient. According to a November survey of 2,400 doctors by the nonprofit Physician Foundation, private practice physicians believe that policymakers ignored them during the reform debate. The results of this survey suggest a potential disconnect between the American Medical Association, which supported the law, and its grassroots stakeholders. Physicians are the individuals who make sure during surgery we are safe and handled properly, and they are the last stakeholder who should have felt ignored. If the physicians stop seeing patients because there is not enough profit involved with the patient's new insurance, then the patients will be the ones who truly suffer. According to a Gallup tracking poll, by the end of 2010, the number of American adults insured through their employers reached its lowest point in 3 years. Although, with nearly 45% insured through work, employers will continue to serve as a critical resource and cost-efficient option for individuals or families to possess health care. Some negative features that employers will face due to Obamacare include penalties for not offering coverage to all employees, and the failure of new health reform to have the desired effect on healthcare costs that were once anticipated. This will force employers to consistently raise premiums while offering the same coverage. Certainly, this will not make the company any more money, as health benefits is a benefit offered, not a source of profit. On December 27th, the Los Angeles Times reported that in 6 months after the law was signed, United Health Group, Inc., the nation's largest insurer, added 75,000 new customers from companies with fewer than 50 employees. Coventry Healthcare, Inc., a Maryland small business insurer, had enrolled 115,000 new workers in the first 9 months of 2010. Insurance companies likely are not going to feel the effects that patients are going to experience, and their main interest will always be to maximize their profit and stockholders' wealth. The last stakeholder we're going to discuss are the hospitals. Hospitals are stuck in the middle of all the other stakeholders. Why, you ask? Well, it's because the hospital is where the patient goes with or without their company's insurance, and where the physicians work. And when the individual's health gets so bad, they will go to the hospital with or without insurance. The hospital then needs to get paid for taking in this patient, giving this patient a room, and ensuring the patient is taken care of. Hospitals are a resource our country could not live without, and we as a nation need to make sure they are taken care of by any new laws implemented or laws that have been implemented in the past.
Before the website Healthcare.gov was released on October 1, 2013, there were already apparent problems with the site. During the development timeframe, the lack of decision makings and authority led to delays in making policy decisions. This impacted the requirements during that time of development. It was unclear throughout the planning and implementation stages who oversaw the launch and the site functioning. It seems to be clear that the project was off to a bad start. With bad leadership and poor management, it can be hard for any project to make it successfully to a launch date. The White House Chief Technology Officer was not even invited to the site planning meetings. This goes to show how bad the project was taking off. The individuals with the appropriate expertise in the field of IT that were needed to make the project successful were not always consulted during meetings that led up to the planning and launch date. The article, What Can We Learn from Healthcare.gov, states that the government knew that the site was not ready for launch on October 1st. A month before the go-live date, the Obama administration decided to exclude a key feature, so many of the project specifications were not frozen once the project took off. The procurement process is the process that helps select the companies that were used for the Healthcare.gov project. The problem with the way the government contracts out jobs for certain projects is that the contracts can be awarded to companies that are better at the process of obtaining contracts and not actually be the best fit for the project. Another problem is that agency staff are not allowed to have any opportunity to discuss or collaborate with potential clients until the contract is awarded. So many companies, just like the 55 that were on this project, did not have the full details of the project until the bid was won. Another issue is that it can be very difficult for newer companies who may be better suited for the job to bid. Many companies may have been way more qualified for the job but never really had a chance. Even if the federal contract is awarded to a contractor and it becomes apparent that the contractor is not fulfilling the obligations of the contract, it can be difficult to change contractors. So basically, even if the government officials or leaders of the project knew that they chose bad companies, it was easier to keep moving forward than to find another contractor. Overall, management had the inability to communicate and coordinate among the high numbers of firms that were awarded contracts for the project. Once the project was released, there were many complaints that led to the discovery that the Healthcare.gov website was not performing as expected. Many users complained that the website was slow, users were being denied access, and the website was difficult to navigate. Parts, if not all, of the website was unresponsive, and it was even disconnecting sessions. Applications were allowed to be submitted with missing information. If applicants started the application process on Healthcare.gov, many of them were unable to save the critical information that they had worked on. The day the site was available to the public, there were 250,000 simultaneous users, with 8.1 million visitors in the first 4 days. The capacity of the site was completely overwhelmed and was only allowing a few thousand users to visit at a time.
The failure of the healthcare reform project has been linked to several factors. Some have attributed its failure to the fact that the project managers lacked the technical skills needed to get the job done. Others have pointed to poor planning and design, time constraint, lack of project control and support, poor communications among the project managers and their project teams, and the lack of proper system testing. While all this may be true, I want to approach this topic from Olson's perspective of what is needed to achieve information system project success. Under the Conflict and Performance section of David Olson's Information System Project Management Textbook, he gave the following list of features that might help to improve information system project success. Project scope and objective communicated to all of the project team. Business rationale for undertaking a project disseminated. Accurate project budgets. Project support present. Project control firmly established, and rules not changed during execution. Citing these features, I'll be doing a step-by-step analysis of why Healthcare.gov project failed. Now let's look at the first two on the list, project scope and objectives communicated to all of the project team. According to Olson, good communication is a major factor in successful project management. It is always important to communicate the objectives and scope of a project to all of the parties involved so everyone knows what is required of them. According to Congressional Report of the 13th Congress 2014, we know that there was a lack of transparency in the sharing of vital information required for the project's success and a host of other communication problems such as the failure of the managers and their team members to collaborate and communicate during the testing and launch of Healthcare.gov. We also know that there were internal conflicts among high-level officials of the Health and Human Services and the Centers for Medicare and Medicaid Services. There was lack of communication among these project managers and the developers. This problem with communication made it impossible to clearly communicate the project scope to the ones they are coordinating. According to Olson, if the project scope is not clear to everyone, those who make decisions related to the project will not be in a position to make the best decisions. Now let's go on to the business rationale for undertaking a project disseminated. We know the Healthcare.gov project was debated for months before the contract was awarded. The logic behind the project was made clear from the beginning, both to the public and government, and no doubt to the project managers and their team members. It was widely spread, though not everyone gave their full support of the project, especially those in the political arena. Accurate project budgets. According to Kessler, the Government Accountability Office stated that the total contract value of the project was $292 million. This was obviously referring to the original budget for CGI Group, which was $93.7 million, and that quickly grew to $292 million prior to the launch of the website, with overall costs for building the website reaching over $500 million prior to launch. Now, during a congressional hearing, the Health and Human Services Secretary, Kathleen Sebelius, provided some figures. According to her testimony, the Health and Human Services had spent $319 million on the website through the end of October, adding that a total of $677 million has been obligated. There are so many conflicting figures out there on the internet. It is clear that there is no accurate project budget, and from all indication, the cost of the Healthcare.gov project is definitely higher than the initial 292 total contract value. Let's talk about the project support present. The political atmosphere surrounding the HCR project shows the evidence of lack of support as there was opposition from both sides of the political spectrum. As in the case for every political driven agenda, there will be some opposition as well as support. That such opposition can manifest itself through small means of uncooperative behavior to delay the project or to reduce its likelihood of succeeding. Project control firmly established. The question to ask here is, was it clear who was in charge at every step of the planning, development, and execution phase of the project? Well, from congressional hearings, we see that much needed governance committee was not in place during the development phase, which meant no one had the control of the workings of the project and its team. Then there was the inability of the project managers to help coordinate the task of the front end and back end developers in working towards proper integration of the system. It was clear that project managers adopted the laissez-faire management style with the project team. It will be safe to conclude that a lack of single decision-making authority led to delays in making policy decisions that impacted the project success during the development timeframe. Rules not changed during execution. It appears that Healthcare.gov project managers and team leaders failed in this aspect too. According to the congressional report, the Health and Human Services made some changes to project plan up to a month prior to the October 1st, 2013 release date. It is possible that there were other changes to resources that were not reported. Making last-minute changes has a way of affecting the dynamics of the project in a way that can only be detrimental to the project's success. Now the time constraint factor. Now this is what we know. Completed project system will draw from multiple data sources, which includes the state, the health plan providers, and other government entities. We also know the Obama administration gave the project team 22 months to complete the project and roll it out to the public. A system with such magnitude and complexity should require more time to integrate all the subsystems needed to be fully functional. Now we know the healthcare reform project specifications were delivered late, delaying the commencement of the project. Despite this delay, the rollout date stayed the same. And according to Courson, projects are collections of activities. If one activity is late, other activities often have to wait for it to finish. We also know that there were key components of the project that were changed by the Health and Human Services a month prior to the project release date. It is clear that the healthcare reform project had a lot of lag time, and with no option to extend the finish date, the contractors had to work under a very tight schedule. Now let's consider the technical factors that led to the failure of the Healthcare.gov. In his analysis of Healthcare.gov failure, T. Owls noted that the intent of best practices was not implemented in the functional testing area of the project, as functional testing appeared to have been performed by the developers only on their own components. Even the congressional report stated that it was not possible to perform full or even limited testing of the complete system with realistic user loads. According to that same report, there was no indication that integration testing was carried out on both the front and back end system. So it appears that the first real test of the system was on October the 1st, 2013, when the system was rolled out to the public. We also know that the project managers lacked basic technical knowledge of the system. This made it very difficult for them as project managers to coordinate and oversee to make sure that everything was tested in order for the system to fully be operational. Not having the real test prior to the release date also prevented the project team from carrying out mitigation plans, if there was any.
Healthcare.gov had many issues with its launch in 2013. An action plan needs to address each issue to ensure a relaunch is successful. When Healthcare.gov was launched, it crashed within a few hours. No one was expecting the site to have so many errors. Millions of people were trying to access the site and it continued to crash. Heavy traffic and technological issues contributed to that. In the action plan, sufficient testing is a solution to correcting the crashes. Testing would need to be a top priority in the action plan. Another major issue in the development of Healthcare.gov was the selection of the contractor. The contractor that was chosen in the no-bid process to build Healthcare.gov was fired from a previous project by missing deadlines. This is something that should not happen when a company selects a contractor. A part of the action plan is to have constant monitoring and management of the project. The contractors would implement daily progress reports to show the status of the project and the schedule. Numerous bugs can be found while implementing the daily progress reports. Nightly maintenance checks were performed after the launch to complete the daily monitoring. In the action plan, project management should make a more realistic schedule to safeguard a successful project. The contractors stated they only had 2 weeks to test the system. A large project like Healthcare.gov needs several weeks to months to be fully tested. The initial schedule did not have development activities or a design timeline. In the action plan, project management should create more realistic requirements due to the complexity of the site. A risk analysis and risk management would provide continuous monitoring and measurement of risk. Poor project management led to increased cost and low functionality with the site. The project needed guidance within its management. A project of this magnitude needs a solid foundation within its leadership in order for the project to stay on track. If the action plan is executed successfully, error rates will decrease. After the relaunch, error rates were down to less than 0.5%. Response times were less than 1 second when compared to the 8 seconds during the initial launch. Many of the software issues are fixed with the upgraded hardware and proper monitoring of the system. The enrollment rate also increased from 30% to 80% after 5 weeks of redeveloping the site. There was even talk about a new feature being added to the site to be even more convenient to the consumer. Whenever a consumer logs into Healthcare.gov and the site is at its capacity of visitors, the consumer can leave their email address. Once the site's traffic has gone down, the consumer will receive an email stating they can log into the site without a wait.
In conclusion, the failure of the Healthcare.gov project confirmed a popular view that project management success depends on balancing the core project components of scope, cost, and time. The ability to balance these core project components is enhanced by the project manager's ability to direct every aspect of the project and encourage a free flow of information and communication among the project team. Anything short of this will weaken the success of the project timelines. It was clear from the discrepancies reported by Congress and the media that Healthcare.gov project managers lacked these abilities. What was also clear was the inability of the coordinators, project managers, and project team to balance their perceived requirements of Healthcare.gov as opposed to the actual requirements. A project such as Healthcare.gov, where the timeline is the main driving force, requires proper planning that focuses more on the scope and resources, with the scope properly communicated to all across the board and the resources well coordinated. The Healthcare.gov project was a total fail at the October 1, 2013 launch. It failed to meet the scope as defined and at the time indicated, and from all reports, failed to produce a deliverable that was on budget.